Do you have an injury or maybe some pain holding you back when it comes to getting in your workout regimen?
Well, if so, maybe a therapy-based fitness program is what you actually need. Now, we met up at BioFit KC to learn about one of the special techniques, they do many, that they actually utilize to get patients back on track with their fitness goals. Hefner and Justin Pryor are the co-owners and creators of BioFit KC, a therapy-based fitness program specializing in muscle activation technique, or MAT.
But we really are looking at all areas of an individual's lives, whether it's their stress levels, their sleep patterns, looking at if they have had an injury, how are we going to work around that, or how are we going to integrate their bodies so that we can break down components and really see where weaknesses are, and not just a weakness of, oh, I can't do a bicep curl at this weight. It's more of a weakness of how's that brain really communicating with the muscles, and how can we improve that muscle function.
Essentially, MAT therapy helps deliver signals to the brain to use the proper muscles when they're needed. Elite athletes such as Peyton Manning utilize MAT therapy, but it's beneficial for people of any age and any fitness level.
We work with people that are 10 years old, we work with people into their 90s, and really what it comes down to is there are people that are looking to exercise and to feel better, but something's kind of getting in the way. There's some kind of repetitive stress, there's some kind of repetitive trauma, small things that kind of add up. And so everybody has something in common here, that they're really pursuing to be in better health, or to perform better, or to look better.
The brain may be running the show, but it isn't the only organ BioFit takes into account.
We're looking at all these different factors of how well can they, their cognitive abilities, are they able to see well, are they able to hear well, can they balance well, because all of that's going to come into then, are they able to move this weight, are they able to bench press this, are they able to squat, because all of those integrated systems really don't work well if the parts aren't working well.
Yeah, they really focus on the foundation, and then they told me that oftentimes people will have like an old injury. They're like, yeah, I broke an ankle years ago, it doesn't bother me. And they said really when they get done doing all the cool things that they do, they said it really is, it's affecting a hip or a knee, or it was just a really interesting, they kind of helped bridge that gap that's often there.
And technology helping us,
of course,
get back in the game, so to speak.
Exactly.
Right. Cool. Thank you, Courtney.